Hi, I'm Ume, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello everyone. We all know that the brain is the maestro of the body. Everything, every function, and every organ in our bodies is controlled by the brain. Even the slightest finger movement is controlled by the brain. We all know that the brain is the organ that is present in the skull and is surrounded by some sort of a liquid. But really, what is the brain in terms of science? The brain is the complex organ that controls thought, emotions, memory, touch, motor skills, vision, breathing, temperature, hunger, thirst, and every other process that regulates body functions. Together, the brain and the spinal cord that extends from it form the central nervous system, or the CNS. In the average adult, the brain weighs about 3 pounds and is about 60% fat. As for the remaining 40%, they are a combination of proteins, water, carbohydrates, and salt. Some people might be confused about the nature of the brain. Because some say train your brain, you might wonder, is it muscle? The brain itself is not a muscle. It contains blood vessels, nerves, neurons, and glial cells. You may happen to have heard a doctor say that the brain is made of gray matter and white matter. Our role today is to answer most of your questions regarding brain tumors. Today we have Dr. Park, who is a leading doctor at the Catholic University of Korea, Bucheon St Mary's Hospital in Korea. He's going to discuss with us everything about brain tumors from an experienced medical point of view. Hello, Dr. Park. Can you please first introduce yourself?
Sure. I am Park Ik-sung from the Catholic University of Korea, Bucheon St Mary's Hospital's Neurology Department. I treat brain tumors and cerebrovascular diseases. I have attended to my patients for about 20 years.
Dr. Park, what is brain tumor?
Brain tumor is cancer that affects all parts of the brain and its surrounding structures.
So what are the usual causes of brain tumor?
All brain tumors are caused when the normal cell division and life cycle of the cells is disrupted and results in uncontrolled cell division and growth at a rapid pace. It affects normal cells' ability to function normally. When the tumor mass grows very slowly, we call it benign tumor. And when the tumor mass grows very fast, we call it malignant tumor. So even with brain cancer, we divide them into benign and malignant tumors. Precisely what causes the tumors is not yet fully known. So, in a nutshell, brain cancer is an uncontrolled, rapid growth of cells, but the reasons as to why it is not yet known.
So you just talked about the types of brain tumor, right? Are all of them malignant?
Cancers can be divided into benign and malignant types. If malignant, we treat them right away, but if it is benign, we tend to watch and see. We see in brain cancer, we see about 50% malignant and 50% benign. Of course, if malignant, we treat it immediately, but sometimes even if it's benign, we have to treat it surgically or via chemotherapy if the tumor is significant in size and affects the brain's functions. So about half of the cases are malignant and the other half benign.
So what are the symptoms usually that patients with brain tumor have?
The symptoms of brain tumor depends on the size of the tumor. When small, there is no symptom. But as the tumor grows and the brain pressure increases, typical symptoms include headaches when woken up in the mornings. Then the patient subsides by noontime. The progression of the headaches in this pattern is a typical symptom of brain tumor. But if the tumor spreads to the legs, arms, or parts of the body that deals with speech, even if the tumor is small, there can be a loss of energy, strange sense of touch, speech impediments, or even suffer loss of full vision. So, depending on the location of the tumor, the symptoms can vary. If the tumor is large, regardless of location, due to increased brain pressure, there can be morning headaches, which are typical symptoms.
아침에 심해지는 두통, 이 특징적인 증상입니다.
Okay. So if somebody suspects to have a brain tumor, what kind of tests can be done to confirm it?
The diagnosis of brain tumors is hard to tell through symptoms. CT or MRI is needed for an accurate diagnosis. Especially MRI is an important diagnosis tool. Through MRI, we can even find tumors less than a centimeter in diameter. We can even differentiate between benign and malignant tumors. So to diagnose brain tumors, we need MRI or at least CT. But CT's resolution is lower. To precisely diagnose brain tumor, we need an MRI scan.
So in the case diagnosed or it's confirmed that it is a brain tumor, is it curable or there's no cure for it?
Like we said before, there are malignant and benign tumors. Benign tumors are usually cured with surgery. Malignant tumors can be seen as two types. Those that spread to the brain and those that started in the brain. Tumors that spread to the brain, we must find where it started. For example, the lungs, liver, stomach cancers, and its conditions. In these cases, we use chemotherapy together with surgery. It's typically sufficient to successfully treat without reoccurrence. Just looking at the brain, treatment tends to be successful. But depending on the rest of the body's cancer, it would affect the lifespan of the patients. Cancers that originate in the brain, such as glioblastoma multiforme, even after surgical, chemotherapy treatment, one's lifespan is shortened significantly, usually less than 2 years. Brain tumors that start in the brain are difficult to cure.
So in the cases where surgery is hard to do, can it be treated with other kind of treatments?
The standard treatment for brain tumors is surgery. In the process, we remove the tumor as well as study the issue. We do not resort to radiosurgery when the location is hard to reach, and in the process, collateral damage is likely. The radiotherapy focuses on the cancer cells alone in order to stop the uncontrolled growth of the cancer. And in the case we discussed that there is malignancy, we supplement with radiation therapy after the surgery about every 6 months or so. We use the radiation in this case to the entire brain, and the cancerous cells react particularly to the radiation. So, where the surgery cannot remove all the cancerous cells, we supplement the treatment with radiation therapy. We also use chemotherapy in malignant tumors. Chemotherapy is administered after radiation therapy in order to prevent the growth of tumors. So, in treatments we have surgery, radiation, and chemotherapy. Basically, 3 types of treatments.
Okay. So in the case of full treatment, how likely is it that it will reoccur?
When benign, surgery alone does the job. With malignant tumors that have spread into the brain, surgery and radiation is usually enough to cure. But malignant cancer that started in the brain, it is not very promising. We must distinguish also by stages. We can look at the grades 3 and 4. For grade 3, on average, a patient may have 5 to 8 years. For grade 4, it is often less than 2 years. It is the most malignant.
So we talked about surgery. Can you please develop or explain more how is surgery done?
For all brain tumor surgeries, we take MRI or CT scans to precisely locate the tumor's location. Nowadays, we use neuronavigation in the surgery room to ascertain the location. Instead of opening the whole head, we only open the location where the tumor is. We make an incision as the tumor lies inside the brain, then remove the skull bone of the incision area. Then we open the brain for access. After locating the tumor, we only remove that alone. We preserve the normal parts of the brain and limit the collateral damage as much as possible. We use electric probes into the brain to monitor it in order to prevent any unnecessary damage. Since we monitor in real time any blood blockings and excessive pressures, our success rates have climbed significantly relative to 10 to 15 years ago. In the past, there were many side effects. Now we only have about 1% with side effects. It has become very good.
Okay. So is there any surgical method to minimize the wound after the surgery?
Yes, even in that category, it has improved quite a lot. The type I do often, minimally invasive surgery, is helpful. I open an incision in the eyebrow area instead of the skull. For this type of procedure, we need navigation, high-definition surgical loops, endoscopes, etc. We use all these tools to minimize the scars. This way, recovery is faster and psychological burden on the patient is lower too. Normally, when someone gets brain surgery, it can traumatically affect emotionally, but with the minimally invasive method, penetrating the eyebrow areas instead of the skull helps the patient believe it is less severe surgery, which positively affects the psychological well-being and expedites recovery.
So are there any precautions that a person should take after a brain tumor surgery?
Even after surgery, there is no difference in what a person can do. So instead of feeling down and depressed, one should carry out a normal life, and that will help in the recovery process too. Without regular movement and exercise, the side effects such as headaches get worse. Lack of coordination and depression can occur if left alone. So I recommend the patient does everything he or she did prior to the surgery. Also keep movements and exercises.
Thank you, Dr. Park.
Sure.
Thank you so much. So brain tumor is cancer that affects any part of the brain. All brain tumors are caused when the normal cell division and life cycle of the cells is disrupted and results in uncontrolled cell division and growth at a rapid pace. It affects the normal cell's ability to function normally. When the tumor mass grows very slowly, we call it benign tumor, and when the tumor mass grows very fast, we call it malignant tumor. So even with the brain cancer, we divide them into benign and malignant tumors. Precisely what causes the tumors is not yet fully known. So in a nutshell, brain cancer is an uncontrolled, rapid growth of cells, but the reason as to why is not yet known. Cancers can be divided into benign and malignant types. If malignant, we treat them right away, but if benign, we tend to watch and see. We see about 50% malignant and 50% benign cases. Of course, if malignant, we treat it immediately, but sometimes, even if benign, we have to treat it surgically or via chemotherapy if the tumor is significant in size and affects the brain's functions. So about half of the cases are malignant and the other half benign. The symptoms of brain tumor depends on the size of the tumor. When small, there is no symptom. But as the tumor grows and the brain pressures increases, typical symptoms include headaches when waken up in the morning. Then the pain subsides by noontime. The progression of headaches in this pattern is a typical sign. Thank you for joining us once again at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.